have an Oklahoma judge delivering his ruling in the state's multi-billion-dollar lawsuit worth about $17 billion against Johnson & Johnson. Let's go to Grady Trimble right now for the verdict. Grady.
Yeah, so the lawsuit was seeking $17 billion in damages. The judge's ruling wasn't anywhere close to that. He awarded $572 million to the state, and he says based on the evidence that was presented to him over the 8-week trial that went on, that's what he's able to give to help what he said would abate the opioid problem, specifically in the state of Oklahoma. Now, the state had claimed that the company was a public nuisance and that it used aggressive marketing that downplayed the risks of opioids and flooded the market with these painkillers. It even called Johnson & Johnson an opioid kingpin. The company denied wrongdoing, but obviously with this ruling, you can see that the judge wants to do something. He did find that they are liable, but he just didn't offer the ruling that the state was hoping for. So this does set a precedent because 2 other drug companies settled with the state of Oklahoma for far under $500 million. So it's still a lot of money that will go a long way in curbing the epidemic if it's used, like the state has said, for drug treatment programs and addiction prevention type programs, but it's nowhere near the $17 billion that they were hoping for. But there are still lots of lawsuits that are in limbo right now. They're pending, and they're actually before a federal judge, 2,000 of them. That judge is encouraging each of the lawsuits to reach a settlement. But it looks like, based on this, they might press their luck and try to get a higher number with a trial. Of course, there's a lot of legal costs that go with that as well. So whether it was worth it in the end, you know, it's hard to say because they didn't get anywhere near that $17 billion. Christina?
Okay. Well, thank you very much, Grady, for breaking it down. Grady Trimble. And we got to go to our new panel. We have Dr. Mark Siegel, NYU School of Medicine professor. He is also a Fox News contributor, and Jennifer Braceras, an attorney and independent women's forum law and liberty director. Thank you both for joining us. Jennifer, I want to start with you right now. Given this verdict, what does this mean for other states that are pursuing or going after pharmaceutical companies? I'm thinking right away Ohio.
Well, you know, I actually...
Sorry, that was for Jennifer.
Yeah.
It has wide-ranging implications for the other cases against opioid manufacturers, but also for other makers of legal products that can sometimes cause harm. For example, well, this case was brought under the public nuisance theory, and it was essentially a creative use of the law to argue that the companies should pay for government costs of a public health crisis. So we also have obesity crisis in this country, right? So what I would expect to see next is states going after McDonald's, Coca-Cola, the makers of other unhealthy food and drink products, and suing them for the public health costs of obesity, because that is essentially what this judge allowed the state of Oklahoma to do. In my view, it was quite lawless, and it will be the consumers who pay the price ultimately.
And Dr. Siegel, just if we're going to touch on what Jennifer just said, do you believe that it's really not, if we're going to go after the farmer, then we got to go after every single other corporation? Or do you believe that this is a much different issue given that 219,000 deaths for opioid prescriptions just over the past 20 years, 40,000 that involve opioid drugs in general? So what do you think, given that you are working within the medical field?
You know, I understand Jennifer's point, but I think it's elegantly stated, because where do you draw the line? But I actually disagree with it. I think they use the term public nuisance, but I actually think it's more of a public health issue here. And I'm glad they set this precedent, because even though, you know, the money that was awarded here is a lot less than was asked for, maybe not enough of a disincentive. Still, it's the most that's been awarded so far. When Purdue and Teva settled, they settled for a little bit over $300 million. This is now $570 million, and hopefully the money will be used over the next several years to help with prevention programs and intervention programs. Let's face it, my view...
But we know that it won't. We know from the tobacco settlement that that isn't what's going to happen. The state of Alaska used tobacco money to build public docks. New York used it to build a sprinkler system for a public golf course.
Right,
the state of North Carolina used tobacco money to pay tobacco farmers, ironically. So
all of this is true. All of this is true, but those settlements that Purdue and Teva made look like they are going in the right direction. You're right that the state has the ability to lateralize any money they get. Medicaid money can be used for building bridges. We can talk about this all day long. State governments have a big problem. But I think that with a public spotlight on the opioid epidemic, it having been called a national emergency, I think you have to hold the drug makers accountable. We're holding physicians accountable. We're clamping down on physicians' prescriptions. We're holding pharmacies accountable. We're starting to move the needle in the right direction. This is the right kind of verdict. I agree with you that it's full of potholes.
I agree.
It's full of potholes here. This is far different than the opioid epidemic. Far different.
It is absolutely a public health crisis. There's no question about that. And there's not a single person I know that doesn't know somebody who's been touched by this crisis. And it needs to be addressed. But as a matter of law, a public health crisis is not the same thing as a public nuisance.
But this drug company willfully, in my opinion, not just willfully, they knew what they were doing. There were drug ads that said "sleep a better night with this drug," completely misusing what opioids were intended for.
Dr. Siegel, wait, Jennifer, 1 second.
Physicians were wined and dined. Physicians were sent on vacations.
But just to your point, the pharmaceutical companies argued that that's not the case because they abided by FDA rules. So is this also a problem with the FDA and the lack of oversight over there?
Well, that's part of it, Christina. It's clearly the rules have changed, and the rules are changing. And you're right, it's hard to roll back the clock, but there's a lot of evidence, and this judge, and they looked at this evidence, there's a lot of evidence that the pharmaceutical companies knew what they were doing. They claimed in this trial that the public knew, too. I don't think the public knew. I don't think my patients knew.
It was on the labels.
On the labels? Well, that's not enough. It's a matter of what public information.
That's not enough to have a warning on the label?
No, I wish my patients all read the labels. I wish they read it carefully. But if you see a blaring TV ad that says this will help you through a sleepless night, and the label says caution, I think that's a disconnect that we have been trying to get past.
Look,
opioids opioids should not be the first choice for treatment for pain. That's the bottom line.
And that may be true, but as a legal matter, you have to prove causation, and there is a very weak causal link between the pharmaceutical manufacturers, the doctors, the distributors, the patients, the choices of the patients. I think that this will get flipped on appeal because as a matter of law, a Connecticut judge looked at this, and the Connecticut judge said that this was causation by conjecture, that there was no way, as a matter of law, that you could prove that any one particular pharmaceutical company led to a particular result.
But then can't one argue, Jennifer, can't one argue this is the power of money and these pharmaceutical companies have so much of it? And if we look at the numbers, 46 deaths per day due to opioids, doesn't that tell us something?
Well, look, the law isn't redistributive in that way. The law isn't meant to be a form of taxation by litigation. Whether or not these products should be more severely regulated, whether or not they should be legal, whether or not these companies should be taxed at higher rates, those are all public policy questions that need to be answered by our elected representatives. But the law and the judge is only supposed to determine whether or not these companies caused the state of Oklahoma to spend money on particular line items in their budget, and that they cannot do.
Christina, I think that the evidence, and again, I haven't reviewed the whole case, but just as a physician should not be overprescribing opioids to a patient that doesn't need them, and many have gone to jail, not enough, by the way, likely not enough. I believe that there was a culture of misinformation here that led to people being harmed, that led to people overdosing, that led to people being hospitalized. I believe the drug manufacturers were involved, pharmacists were involved, and physicians were involved. And I'm up here saying that it's not just the pharmaceutical companies. Of course not. It resides primarily in the doctor that signs the prescription. But pharmaceuticals misinformed physicians. I'm extremely aware of it, and I'm glad they're being held accountable. Will they appeal, and will they use all their money and power to appeal? Sure, but if they win their appeal, it doesn't necessarily mean that justice has prevailed either. That might be power that's prevailed.
Okay, and we're going to leave it there. Thank you both for such an animated debate, Dr. Siegel and Jennifer Braceras. And we'd like to point out, too, that Johnson & Johnson shares are climbing higher in after hours.
They are. That is important.